The Eastern Cape Democratic Alliance has slammed the Provincial Health Department for wasting resources. It recently came to light that some staff members who worked at the Orsmond TB Hospital in Kariega are still getting paid despite the facility closing its doors almost 2 years ago. Meanwhile, Workers' Union Nehawu has defended the workers, blaming the department for a lack of consultation. For more on this conversation, we're now joined by the Deputy Eastern Cape Nehawu Secretary, Sweetness Stokwe. Sweetness, good to have you, and thank you very much for coming on tonight.
Good evening to you, sir, and the viewers. Thank you.
So, according to member of the Provincial Legislature, Jane Cowley, writing to the head of the Department of Health, she has found out that there are 45 workers that are continuing to be paid even after that facility has closed down, and she went and did oversight herself and did find a couple of workers who are still going to that facility. Now, she, of course, is telling us that they were told that proper consultations were done with labor and everyone else, and it was agreed that that facility was not attracting enough patients and should be closed down, and those staff members be I suppose, allocated to other areas where there is need. Let's start there first and foremost. What was that conversation had?
It is worth mentioning that what is being said about consultation being done is not true. It's not true, and it was Nehawu particularly who forced the department to say that there can be no change of employment contract or duties of any workers, particularly on the hospital that is gazetted as a TB hospital, without any consultation. We first heard about this as a union from our members when we were told that they are being directed to move to other facilities. When we wrote to management of the department in the district, in the Nelson Mandela area, to establish as to what informs the hospital being closed, because our understanding was that we still had TB in our hospital. We had areas, surrounding areas of Utenek or Metro, whereby care code communities who are people who are diagnosed with TB will be transferred to Orsmond TB. People coming from Ado area will be transferred. So we did not get a report as to what informs the closure of the hospital. And remember, in Nelson Mandela Metro, prior COVID, there were 2 TB hospitals and 1 MDR hospital TB. And when COVID came, the one from PE in Mpilweni was closed, and all those patients from that hospital were transferred to Orsmond. So Orsmond had their own patients together with the ones that were transferred, because Mpilweni Hospital had to be made a COVID hospital. So we were shocked when we heard that the hospital is being closed without any proper consultation. And you will understand that some of the employees who are our members, particularly doctors and other positions, were employed on the basis that they are specializing in TB. So now if you're going to change their employment and take them to a normal hospital or in any other hospital, you need to consult, because they are having a specific specialized qualification to deal with TB hospitals. So in the process of trying to establish this, we received some arrogance from the management, and as a union, Nehawu in particular, we referred the matter for a dispute to the bargaining council. While we were busy with that, the department threatened to deduct some salaries from our members. We went to court to interdict them, and we successfully interdicted them. The court ruled in our favor that they cannot deduct the salaries of workers when they have not consulted. And also, again, when we went to the bargaining council, again, it was proven that the department, there are proper processes in terms of consultation, and they have not followed it. And as a result of that, there were many meetings amongst us as Nehawu and other unions who are our sister unions that sat with management. At some point, even community organizations, civil organizations were called, where we wanted to establish as to what informs this decision and why there is no consultation, especially on issues that are not only going to affect workers, but society at large. As we speak, we can tell you now there is a security company that is being paid there on a monthly basis to watch after the facility. And if you go to those securities, they will tell you week in, week out, there are families that are turned down to go back to the society with patients that have been diagnosed with TB who have received letters being transferred to be admitted. And this decision has not been communicated with other facilities in the metro and surrounding areas. As we speak, we're getting reports from our members and leaders, stewards from Newzroom Provincial Hospital, where they are indicating that patients who have TB are dying week in, week out. And there's a possibility that there might be even a pandemic of TB because many TB patients that have been diagnosed that were supposed to be admitted are around our communities. And those patients, they've moved as an indication from them, indicating that there were few. They've moved them to, there is a hospital that admits MDR TB patients, which is Joseph Pearson, that is in Port Elizabeth. We received also, when we made a follow-up as to what has happened when those patients who have been transferred from Orsmond, we received reports there that the facility was not enough. Some patients who are both males and females had to share wards. So there was an investigation that was supposed to happen where we were supposed to do a walkabout to check these concerns that were being raised by our members in terms of being imposed where normal TB patient as well as MDR TB had to share.
So as Nehawu, you are saying, one, you're disputing the fact that there are dwindling TB patient admissions at the Orsmond TB Hospital.
Can you repeat that again?
I'm saying, are you disputing what is being raised here by the Provincial Health Department, that they are closing down this hospital or facility because the number of patient admissions are going down and they don't meet the requirements?
It's not true. They have failed to prove that on many occasions. It is them that have turned away the TB hospital, the TB patients who be admitted there. Because the report that we received when we consulted our members in the facility is that while there were patients there, people who were referred by doctors from surrounding areas who usually got to be admitted were turned away. So they created a situation whereby it would appear as if that there is a less number of patients. They created that. And we have requested on many occasions to receive a report whereby they will present to us as to what has resulted them to take a decision. They have failed to do that.
All right. And
so much that the settlement agreement we had with the department was that for that hospital to be closed, that decision must be taken at the provincial chamber. And we are still waiting for that because as things stand now, there is a restructuring that is happening in the province, and we're in that process.
So, too, you are also saying that the patients that were moved there have not been properly accommodated in the other facilities that are in the province?
No, they have not. And that's the concern that we have raised with the department because the TB facility that they were transferred to, it's the MDR TB hospital, which is a total different type of TB compared to the one that they were in.
And now, why has it taken 2 years for Labour and the government to sit around the table and iron this out? Because this has resulted in what could be viewed as wasteful expenditure where employees have been paid for doing no work.
It's part of the things that we've been raising as a Nehawu in the province, that particularly in that district, since the former minister, Dr. Mkhize, we've been saying that there is no management. Even if you can remember, during the time of COVID, that district used to be a hotspot every now and then. So we've been calling now that workers now, they want to shift the blame to workers when we've been saying that there is no capacity in terms of the district management. And we've been making an appeal to the department at the level of the province and national. Even if you can go now to the portfolio committee of the department nationally, they have been here a few weeks ago. They will give you a report about the state of that district. There is no capacity in terms of management in that district. We've been saying that for years. The decisions that are being taken are reckless, are affecting workers, are affecting our society.
Yeah.
The
response that was given to the Democratic Alliance was this labor dispute matter would be resolved by the end of June. Okay, we are now in mid-July. Clearly, it has not yet been resolved. Is the department not telling the truth that they are working at resolving this particular matter?
We know that our members have been threatened, and we have been clear that the department is the one that is in contempt of court, because the court was clear, the bargaining council was very clear as to what needs to happen. And we're hoping that the MEC will make the senior manager who have created this situation to account, because it goes down to senior managers who do not have capacity, who do not have the best interest of the department at heart.
Yeah. Do you see this matter being resolved by the end of July?
It can be resolved, but drastic decision needs to be taken. Proper processes needs to be taken in terms of involving all the role players, because even the society has been raising this as a concern.
Sweetness?
Because there are a lot of equipment that is there,
yeah,
and people are dying. Because if you go to Newzroom Provincial Hospital, where these patients are being referred, where they are critical, that is not a TB hospital. There is an equipment in that hospital whereby it's supposed to assist TB hospital.
Right.
But these patients are being admitted across Nelson Mandela Metro hospitals, where it is not capacitated for them to be treated.
Sweetness, appreciate your time. Thank you very much for coming on. We'll call on you again soon, as soon as we get response from the Department of Health on this particular matter. Eastern Cape Nehawu Secretary there, Sweetness Stokwe.